We've been hearing a lot about social distancing lately. It's why businesses are either closing or reducing capacities. Health experts say we may not be able to control the overall number of coronavirus cases, but we can all do our part to help prevent a spike that would overwhelm our hospitals. Our Lauren St. Germain joins us now in the studio, a good 12 feet apart from me, with how we can all do our part. Lauren?
Yes, we are very far apart. Thank you, Jameson. So I know you've seen this graphic. It's all about flattening the curve, and we're at a crucial point where we have to take these protective measures very seriously in order to not go above this dotted line right here. It's so truly important, and it's really thinking of other people, not just yourself. And if you're not sick, it may really be hard to wrap your mind around this concept. So just yesterday, the White House announced new aggressive recommendations for the next 2 weeks. First up, avoid gathering in groups larger than 10, even at your house. Also, avoid restaurants. And as of about 30 minutes ago, you can't even go to bars or nightclubs in the state anymore. The governor closed them for the next 30 days. President Trump also said we should teach school lessons at home. The best way to prevent illness is to avoid being exposed to the virus. And that's why the CDC is still saying when you're in a setting with other people, just like Jameson and I right now, you need to stay 6 feet away from each other at all times. We've all been watching the lockdown in Italy, and the Surgeon General of the United States says that could happen here in the U.S.
Look, we're at a critical inflection point. We have the same number of cases now that Italy had 2 weeks ago. And we have a choice to make. Do we want to really lean into social distancing and mitigation strategies and flatten the curve? Or do we just want to keep going on with business as usual and end up being Italy?
Guys, we want to lean in. We want to flatten that curve. The CDC says the virus is thought to be spread mainly from person to person, and this could happen a few ways, like when people are in close contact with one another, or when an infected person coughs or sneezes and those droplets land on a person nearby, or they breathe them in. So we know there are a lot of cancellations in the Bay Area and changes happening in our counties. We have everything you need to know broken down on our website for you, abcactionnews.com/virus. It's a great resource for you to have bookmarked on any single device with internet right now. Jameson, back to you.
Lauren.